All right, let's talk about something really important but also really misunderstood: parental mental health. For way too long, the whole conversation has been kind of stuck on just one word: diagnosis. We're going to flip that script, removing from just the symptom to the entire system that a parent lives in. So, let's dive in.
First, just look at this number, 18%. So what's that? Well, according to the National Survey of Drug Use and Health, that is the percentage of parents in the U.S. who've had a mental illness in the last year alone. I mean, just think about that. That's nearly 1 in every 5 parents. This isn't some small, fringe issue. It's everywhere. And it brings up a really, really big question.
So that number naturally leads us here. If a parent has a mental health diagnosis, does that automatically mean their kids are at risk? You know, for a long time, the legal system, social services, their answer was a pretty simple and honestly a really damaging yes. But what we're about to see is that the real story is so much more complicated than that.
Okay, so to get a real handle on risk, we have to first understand what we're even talking about when we say parenting. It's not just one thing, right? It's a whole collection of really complex jobs. And this is exactly where the daily challenges of a mental health condition can clash with the demands of raising a child.
So researchers have this really useful framework. It's called the McMaster model of family functioning, and it breaks the job of parenting down into 3 main areas. You've got your basic tasks, that's survival stuff. Then your developmental tasks, that's all about growth. And finally, hazardous tasks, which is basically handling emergencies. Let's walk through each one.
So, basic tasks. This is the absolute bedrock. We're talking about the essentials: food on the table, a roof over your head, and a steady enough income to make it all happen. Now, a mental illness can throw up some major roadblocks here. But what's crucial to understand is that it's rarely the illness itself, just existing in a vacuum. It's how that illness bumps up against all these outside pressures.
And just look at this data. The gap in full-time employment is huge. For fathers with what's called a serious mental illness, or SMI, the rate is 60%. But for fathers without a mental illness, it's 85%. For mothers, it's 38% versus 50%. And the research is really clear on this. This isn't just about symptoms making it hard to work. A huge piece of this puzzle is social stigma in the hiring process, which can completely torpedo a family's stability.
Okay, so moving on from just basic survival, we get to the second domain, developmental tasks. This is all about nurturing a kid's emotional and social world. It means a parent needs to be emotionally available, keep their own feelings in check, and be able to sensitively pick up on what their child needs. Things like emotional dysregulation, which you see across a lot of different disorders, can make this really tough. It can lead to things like inconsistent discipline or even what's called parent-child role reversal, where the parent starts to expect the child to take care of their emotional needs. And the third bucket, hazardous tasks. This is all about dealing with the stuff you can't plan for. Your kid gets sick or hurt, or maybe there's a community-wide crisis, like a natural disaster. Look, these things are stressful for any parent, full stop. But for a parent already managing a mental health condition, that extra stress can make it even harder to monitor the situation, plan a response, and act effectively. So we've seen the areas where parenting can get tested. But here it is. This is the big aha moment from all the research. It turns out that focusing on a specific diagnosis, like saying, this person has depression, or that person has ADHD, it's not actually the most helpful way to look at this. There's something deeper going on, a core issue that cuts right across all those labels. And that brings us to this really important idea, a transdiagnostic mechanism. Okay, think of it like this. Instead of looking at the label on the outside of the box, we need to look at how the engine inside is actually working, or not working. A transdiagnostic mechanism is an issue with a core function, like your attention span or how you regulate emotions, that's shared by people with lots of different diagnoses. So what is this core function? Well, the research points right to this. The real key, the thing that matters most, is how a parent processes social information. It's all about the mental steps they take to see what's happening, figure out what it means, and then decide how to respond to their child and the world around them. And if we can understand that how, we're in a much better position to find solutions than if we just know the what of their diagnosis.
And this model, man, it's such a great way to visualize that whole mental process. It's called the Social Information Processing Model, or SIP for short, and it basically breaks down into 3 key steps. First, you have your schema, which is like your mental filter. Second, your executive functions. Think of this as the CEO of your brain. And third, your appraisals, which are the judgments you make based on all that information.
Let's start with schema. Your schemas are just your internal rule books and your expectations for how the world works.
The problem is when those rules are way too rigid or totally unrealistic. This quote from the research is just a perfect example. Expecting an 18-month-old, a toddler, to comfort you when you're sad, that's a complete mismatch with where that child is at developmentally. And this isn't about being a bad parent. It's about having a cognitive filter that's out of sync with reality, and that can lead to a lot of frustration and really unhelpful reactions.
Next up, executive functions. I love this analogy. They really are like your brain's air traffic controller. These are the skills that let you plan things out, focus your attention, remember a list of things to do, and juggle multiple tasks at once. When that controller isn't working at 100%, which is a really common transdiagnostic issue, it can lead to disorganization, trouble adapting to a child's needs as they change, and just poor decision-making, especially when you're under stress.
So if the problem is this complicated dance between a parent's internal world and their external environment, well, the solution can't be simple either. It's not about trying to fix the parent. It's about building a better, smarter, more compassionate support system around them.
And this slide just lays it out so perfectly. The old view basically saw mental illness as a kind of personal moral failing. But the new view, the one that's much more accurate, sees that a parent's capacity is only limited or disabled when the world around them is disabling. That is a game-changing shift. It moves us away from blaming the individual and toward looking at the environment.
So how do we change that disabling context? Well, the research points to some big systemic solutions. It means we have to fight the stigma that leads to parents losing out on jobs and safe housing. It means actually using the legal protections we have, like the Americans with Disabilities Act, to protect parents' rights. And it means training the people and helping professions to get past their own biases. The source actually calls it therapeutic disdain, and instead help build real, practical social support networks. Now, at the same time we're fixing the system, we can also give parents tools to build their skills directly. But we have to be smart about it. That means changing standard therapies to work for people who might have cognitive challenges, like slower processing speed. It might mean using something called cognitive remediation to actually strengthen those executive functions. Or it could be as simple and powerful as using visual aids, like a checklist with pictures, to help get around any difficulties with memory or attention.
And this is where the solutions get really, really cool and creative. The source talks about this computer game called Home Safety Hero. It's literally a game designed to train parents to spot hazards around the house. And it's especially great for those who might not do well with a textbook or a lecture. It's fun, you can do it at your own pace, and it builds real skills by just practicing over and over. It's a perfect example of finding a clever way around a cognitive roadblock to reach a parenting goal.
I mean, this quote right here is really the heart of this entire explainer. Parenting is disabled only to the extent to which the context in which parents live is disabling. It tells us that a diagnosis doesn't disable a parent. A disabling context does. This idea completely reframes how we see parents with mental health challenges. They're not inherently broken or incapable. They are capable people trying to function in a system that has often failed to support them.
Which leaves us with one last question. And it's not just for researchers or people in government. It's a question for all of us. Now that we know this, how can we, in our own communities, in our workplaces, in our own social circles, start to build a context that is enabling instead of disabling for every single parent out there?